What makes us special are the people that are here. We're a tight-knit community, we support each other, and I think that really helps our students thrive. We are located in Gunnison, Colorado, a public liberal arts and professional degree granting institution.
This is a place where people really care about each other, and there's a lot of commonality in terms of passions and interests for why they're here. Conversely, I think the challenge is our location, and we're a rural community, small school, small town environment. And so we don't have all the amenities and all the bells and whistles of bigger metropolitan areas.
We're a really remote location. I mean, even from Denver, where a lot of students come from, it doesn't seem that far, but it's still 3.5 hours, and it's inaccessible in the winter a lot because of snowstorms. So on top of dealing with being a college student, they're also, in many cases, isolated.
Mental health is like a big deal here in the Valley. We have a lot of cold months here, and you can get the winter blues, as we call it. You can get cabin fever really easy. So like a lot of our programming is centered on bringing students out of their room, engaging with us, engaging with each other.
I think that there is a mental health crisis on campus, and I think it's something that Western has worked really hard to kind of mitigate and help. But I mean, there's a lot to be done and a lot that we don't know, and we don't know how to help.
We didn't have a lot of resource to put towards this. We contracted with a local center for mental health to provide counseling services for our students.
Again, it's one-on-one, in person, and that was always been our priority, was providing that service. But we didn't have, the ability to meet the student demand.
I've had several situations where I've had to talk with students about their options for mental health support in the Valley. And one of my first semesters here, I remember walking one of them to the counseling center and then finding out that they had several weeks of waiting time before they could even see a counselor. And it's disheartening.
It was an imperative that we had to figure out other solutions. And so Timely Care was a great ability for us to expand in a way that was cost effective.
It's really nice to have Timely Care as an option because we can explain to students it's available whenever you want it, whenever you need it. It's not a requirement, but it's there. And so having Timely Care in their back pocket, literally on their phone, the thing that they'll never be without, is just an amazing resource.
Having Timely Care in the Valley at your own convenience and privacy means a lot in a small community where there is a tight-knit network of people that all know each other, which is a fantastic thing. But when it comes to maybe some more intricate details of your personal life, sometimes you don't want everybody to know about that or make an assumption if they see you coming out of a counseling office.
There's still that stigma, I think, about going up to the counseling center and accessing that kind of service. So I think we can capitalize on people's positive experiences and have them start telling the story of, hey, this is what my experience was with Timely Care, and really normalizing the conversation around mental health.
As an RA, we do a lot of work with Timely Care. If we are in crisis response, and we can just pull it up on our phones, give it to the person in need, and they get taken care of in that way. In my personal life, I've used it as well. I've found that for me personally, I wanted to choose, or at least have the option to have someone who identifies more closely with me and my needs. And so with Timely Care, you're prompted to say oh, this is my ethnicity, this is my race, this is how I identify. If I could have someone who can meet those needs, that is preferred. And I love that.
Part of my standard conversation when I'm talking with students is I let them know about our resources. I tell them about our on-campus service, but I also make sure they get the Timely Care information. And many times I'll sit there with them and make sure they put it in their phone.
Some faculty during their advising sessions will have the QR code on their desk, and before their students leave from advising, they're making students scan that code, sign up, and then they're good to go. I mean, even if they don't need it right then, they're having a mental health crisis, we're going to be able to quickly recommend and tell them exactly what they can do on there.
Having that resource of the Timely Care app at my hands, it just makes sense. I don't have to pay anything. The school pays for it, so why not?
I was Very stressed. You're definitely juggling a whole bunch of different things when you're on a sports team here at Western. On the track team, it was kind of just one big family, which was great. It was a great support system, but it got a little claustrophobic. There wasn't any ways for me to reach out to anybody else.
After the visit with Timely Care, I would feel like relieved and knowing that I got something off of my chest without putting that weight on somebody else.
It's super easy to set up appointments. I love using the Timely Care app for that.
I could use it when I need it and like when I want to use it. It's really nice to have it like in those in-between moments where it's like, I know I have finals coming up or I have 3 exams and a presentation, so it's like, let me make a call, right?
The service level was so great with Timely Care for our students that it was an easy decision to say, let's expand this relationship to include the service for faculty and staff.
The fact that they've been willing to invest in a service that does have professional mental health providers, both for our students and our faculty and staff, lets us know that they care.
Timely Care has had a really positive effect on my overall mental health here at Western.
It's helped me. It's really helped me get to the place that I am.
It was really nice to just like have that sense of relief after a session and kind of just like being in a space where I could really like process what I went through.
In my tool belt, I now have the confidence to just talk with others about what I'm going through instead of shutting it all in and putting up a wall and a mask.
We're doubling down on making sure that we're supporting our students in this regard. I can't foresee a situation in which we would move away from Timely Care. It's going to be a big piece to our puzzle.